Hi, I'm Dr. Anurag Gupta, Senior Consultant Neurosurgeon and Spine Specialist. Today we will be talking about slip disc or a disc prolapse. So let's start with what is a disc, what is the purpose of the disc, and how it affects us if it comes out. Now this is the model, a model of a spine where you can see this is the vertebrae or the bone, one vertebra on the top, one vertebra on the bottom, and on the back you can see where the nerves, this is the nerves going down the spinal canal, and this is the nerves coming out of the foramen. In between every vertebrae is a disc. Now the disc acts like a shock absorber. It works to absorb all the shocks which go through our spine every day in our every movement, either it's walking, sitting, getting up, moving forwards. And it works to maintain the height of our spine, of our body, and also works like a cushion and a spacer between the two vertebrae. Now, as the name suggests, a slip disc basically means when the disc slips out of its position and either goes backwards and presses on the nerves or the spinal cord. Now, the disc has two parts. You can see a net-like part outside, which is called the annulus, and a jelly soft part inside, which is called the nucleus pulposus. The purpose of the annulus is to maintain the jelly part inside to keep it as a contained space. Now, why does a disc prolapse or a slip disc happen? In most cases, as we age and as we keep using our spine, this part becomes weaker, and there can be a small defect or a crack in the annulus, which lets a piece of the a jelly-like material to come out and press on our nerves or press on the spinal cord. In some cases, either due to trauma, we had a fall or a car accident, or somebody who's lifted a very heavy weight, it can suddenly have a piece popping out and pressing on the nerves. But in majority of cases, there is rarely a preceding cause of trauma or injury, and it just happens on its own because of changes over time. Now, what are the symptoms of a disc prolapse? That the symptoms depend on the size and the magnitude of the slip disc. If it's a small piece, suppose a small piece comes out here, this will not cause much more than a back pain or a discomfort. However, if the piece is big enough or comes out far enough in the canal, it may go and press on the nerve roots here. You can see the nerve is getting pressed here. This will cause either pain or tingling in the hands or in the legs, depending whether it is in the neck or in the lower back. This, in extreme cases, when the pressure is quite extreme, it may also cause weakness or difficulty in moving that arm or a leg, depending on how severe the pressure is. In certain extreme cases where the disc can go and press on the spinal cord, you can always develop a weakness in all your hands, all your limbs. You can even develop difficulty in passing urine or passing stools. But that's a very extreme case and rarely happens like that. Now, what are the how do you prevent a disc prolapse? You can prevent a disc prolapse by keeping your spine healthy, by being active, making sure your muscles of your spine, of your neck, of your back are strong, your core muscles are strong, so they provide adequate control and adequate support to our spine to withstand the normal daily movements of our life.